So we're joined by Terry here today, and now Terry's been on a weight loss journey with the injectable treatment Manjaro. Terry's lost around about 16 kilograms over the last 6 months. He's gone for a very sensible and controlled weight loss, and he started to notice some signs of the weight loss from his face. There are some positive signs. He's able to see more of his bony structure underneath, but he's also started to noticing some volume loss, and that volume loss is generally starting to appear in certain parts of the face, making him feel that although physically he's looking slimmer and trimmer, his face is starting to look a little bit more gaunt, a little bit more tired. So I'm going to run you through how we assess a face that's starting to develop some volume loss signs, and which areas anatomically can we add the volume back in using some treatments like dermal fillers, what type of fillers we can use, where we can place those, and what that is likely to do for a patient who's still on their weight loss journey. At which stage is it sensible to start revolumizing if they've still got some weight loss to go? So what we're looking at is we're looking at upper third, middle third, and lower third. And generally for men, lower third actually ages very positively as we start to look a little bit heavier and jowlier. Our chin looks wider, our jawline looks broader. So at the moment, that's something, and also with the beard, Terry's not really going to be noticing much over there. We have very little volume of fat in the upper third anyway, so generally temporal hollowing, forehead hollowing, that's not something that patients who experience weight loss notice unless there's been extreme amounts of weight loss. The most common areas where weight loss tends to occur is in our facial fat pads, which are most visible around the orbit, the eye area, the front of the cheek, the side of the cheek, this buccal area underneath the cheek, around the nose to mouth line, and then also eventually you're going to start to notice that in the lower face as well, which will be the chin, pre-jowls, and in the lips. And what I'm noticing for Terry is Terry has a slightly stronger side and a slightly flatter side, so that shows to me that he's probably got more weight, more pressure on his face from this side, generally from us lying on that overnight, and compressing that part of the face. And then if I just turn him a little bit towards the camera this way, a little bit more, there we go. We can start to do our tests. So one of the tests I like to do is when patients present and want to have their volume assessed or they've lost some weight, is for me to just try to replace that cheek volume by pressing and seeing how that mid-cheek groove, that separation between the nasolabial fat pad and the zygomatic bone changes just by a little bit of pressure over here. And we can see just by me doing that, that shadow or the hollowing here gets better. So that shows that there's room for us to revolumize certain parts of Terry's mid-face. He hasn't got aggressive weight loss. We're not seeing very deep lines or grooves. We're just seeing gradual gullies starting to form. So we can start to draw those out. So if we draw along the orbital rim, that's the end of his eyelid, the beginning of his cheek, we can mark that all the way around. We can mark out his piriform fossa, his nasolabial line. And then we can start to mark out the areas where we're starting to see a separation along his cheek. So we're seeing the strong nasolabial fat pad over here, so we can mark that up. And L, and we have the zygomatic arch of the cheek over here, the Z, and everything in between here. So this area in the middle is what's starting to become hollow for Terry. So we can use specific types of filler to go in quite precisely and to revolumize that. So if we were to use the other side as an example, if we just turn Terry a little bit this way, we can see that actually by us placing some high density filler deep into the piriform fossa, some into the anterior cheek over here, along over here, that's going to start to connect his zygomatic, his cheek arch, to his maxillary bone, the front of the cheek or the apple of the cheek, which is actually the most common area where we get hollowing. And then also patients start to notice some hollowing along the orbital rim over here. So a little bit of filler along the eyelid junction there. That would be my approach to revolumize the face for Terry. As it progresses, if patients present in a little bit more of an extreme weight loss scenario, they've lost so much more weight, 20, 30 kilos, they'll just notice the same areas of volume loss, but they'll be more pronounced. So there'll be a much deeper groove requiring much more volume to replace that. But this is typically my starting point. 1, 2, 3, with a needle, intraline M4, deep onto periosteum, and using a bolus technique to revolumize on the bone and almost anchor the skin off the bone into a new position so that it's not sitting in the gully and you're replacing the volume. And then eventually, if patients have more volume loss in the other areas, so areas such as the buccal shadows, we can actually then continue placing some volume into the deep cheek fat below here, and then also a little bit into the zygomatic arches here so that they don't look overly bony and that they have a natural volume overlying them too. So that would be the next stage, but Terry doesn't have that kind of volume loss yet. And then we can also then start to revolumize in this area over here where we have usually a little bit of a dimple forming as we start to lose volume in the lower cheek or in the buccal area as well.